It was a chilly afternoon when Mr. Anderson, a 72-year-old retired teacher, walked into the emergency department, supported by his worried son. He had been struggling with a fever, relentless coughing, and a heavy chest for the past 3 days. His breathing seemed labored, and his skin had a pale hue. Dr. James, a seasoned internal medicine specialist, took over his case. As he listened to Mr. Anderson's chest, he heard the telltale crackles in the lower right lung. A quick pulse oximetry revealed his oxygen saturation was 92% on room air, and the chest X-ray confirmed his suspicions: consolidation in the right lower lobe. Community-acquired pneumonia, he thought. But he knew there was more to uncover. Dr. James acted swiftly. Based on local guidelines, he initiated empiric therapy with ceftriaxone and azithromycin, a common combination for treating bacterial pneumonia while covering atypical organisms. "Let's also send blood and sputum cultures," he said, instructing the team. "This will help us identify the culprit and refine the treatment." As the antibiotics began to work, Mr. Anderson was admitted for observation. 3 days later, Mr. Anderson was showing signs of improvement. His fever subsided, his breathing eased, and his appetite returned. Then came the lab results. Streptococcus pneumonia was identified from the blood cultures and, importantly, it was sensitive to penicillin. Dr. James gathered his team. "Time to de-escalate," he announced. "We'll switch from ceftriaxone to penicillin G, or high-dose amoxicillin orally, since it's narrower and targets the organism directly." His reasoning was clear. Broad-spectrum antibiotics, while life-saving, come with risks: resistance, side effects, and disruption to the microbiome. With the new treatment, Mr. Anderson continued to improve. Dr. James planned a 5-day course of antibiotics, as evidence supported shorter durations in stable cases of pneumonia. As Mr. Anderson prepared for discharge, he shook Dr. James's hand with gratitude. "Thank you for taking care of me," he said, his voice steady now. Dr. James reflected on the case during his evening rounds. It was a textbook example of the art of antibiotics. Start empirically, use data to refine therapy, and treat for the shortest effective duration. Narrow-spectrum antibiotics and evidence-based care ensured Mr. Anderson received only what he needed to heal. As he logged off for the day, he couldn't help but feel pride in practicing antibiotic stewardship, treating the patient while safeguarding the future.